childhood education, represents the child care workers here in this state. They have a say as well as we're slowly getting our kids back to school. That involves child care, and they have a point of view, which we ought to talk about a little bit today. But first, I wanted to talk about utility accountability and reform. We got hit hard by a tropical storm a few weeks ago, and you don't want to lose these moments. You want to make these learning moments. You want to get better. After George Floyd, we had accountability and reform. After this tropical storm, we have utility accountability and reform. And the Public Utility Regulatory Authority, PURA, is meeting right now. They've been meeting all day. There are well over 1,000 people voicing their discontent in terms of how slow the utilities were in responding to what was a really severe storm, and in many cases, 6, 7, 8, 9, 10 days to get their power back on. And how do we learn from this, and how do we do things differently? We had a learning lesson about 10 years ago with Sandy. We thought we put in some reforms then. They didn't really make a big difference in terms of performance this time around. And as the chart says, insanity, keep doing the same thing and expecting a different result. And what's really important is, lawsuits and refunds and firing CEOs. It's important is that we tie the incentives together in a way that Eversource and the consumers of the state of Connecticut are aligned in terms of making sure the key priorities are taken care of. And that's what a performance-based rate of return means. And that's what I am pushing on, and that's what I testified on today at the PURA hearing. And a performance-based means you get a good rate of return. In this case, it's about 9.5%. Not for showing up, not because you were an electric utility, but because you've earned performance metrics in a number of different categories. Here are a few of them that Marissa Gillette, who's our great chairperson of PURA, came out of Maryland, where they did put in place some very interesting performance reforms already. So we're learning from that example. Number one is affordability. Let's face it, we have some of the highest rates in the country. Right now, for a utility, it's a pass-through. The electric generators, be they wind, be they natural gas, be it nuclear, they just pass along those expenses on to you. I'm not big on just simply passing along. I like people to have incentives to hold down costs. Related to costs, of course, is compliance with the environmental goals. So I'd like to hear the Environment Committee at the legislature as we weigh in, as we think about energy sources and their carbon footprint, as we try and get the right balance going forward. Probably most importantly, given the example that we all had, given the outages just a couple of weeks ago, is reliability and resilience. And there, again, there's a cost-benefit analysis to that. But what we ought to do is reward electric utilities, in this case Eversource and UI, in terms of A, how they reduce the number of outages during good time, that's called reliability, and how quickly they can restore power during bad times after a storm. And that's a metric that I think we ought to be serious about right now. And we measure based upon outcomes. It's not our job to say this should go underground or this should be aerial. Unfortunately, Connecticut, we have a lot of ledge. So I know from firsthand that underground is very expensive, except in the most important circumstances. And underground is not as good next to shorelines where you may have increasing flooding over a period of time. For better or for worse, I love the trees, but the trees also wreak havoc in terms of electric reliability. And we got to measure that. And probably, from my point of view, most importantly is smart meters and remote status monitoring. We were forced to do that in the cable TV industry. We did that 20 years ago. And I was really surprised that every single town I went to visit during the outages, we were waiting and waiting and waiting for that lineman from Eversource to show up. So you could see in a picture like this, when that wire is down, the tree took it down, we needed a line person to measure the voltage and make sure that wire was off and it was safe to start making repairs. I mean, there, I think there's incredible room for performance, whether it be pre-positioning more line people or more remote status monitoring so you can actually turn that hot wire off and get the repairs done sooner. Make safe. It was incredible how long it took to make safe, to get those roads safe, to get those roads cleared as a precondition to getting electricity on, and getting electricity on was a precondition to getting your internet and other telecom services on. So that is what we're tasking PURA, we're urging PURA, take another look at how we regulate the utilities. I'm happy to reward for good performance, and I'm happy to penalize for bad performance. I think that's how you get good performance, and I do not want to have happen next time what happened last time. That said, we can answer questions on that. COVID daily summary. Daily summary is now for the last few days, which I think is appropriate. Of interest here, I think you'll see we've done a lot of testing, 55,000 tests. I think that's about 125,000 on a weekly basis. The positive cases is 492, looks like a big number, but as a percentage of all the tests, that's still below 1%. And you know, we feel confident on that number, feel good about that number. Fatalities, 0 for 3 days. That is just prayerfully good news. And hospitalizations, about the same, +3. But look, we're not out of the woods, so to speak. And we've been watching like a hawk, as I keep saying, all around the state what is going on. And one place that we're a little worried about is Danbury, where there seems to be a cluster, where there seems to be a fair number of infections going on there. They've surged up a little bit. There's a 7% positivity rate. If the rest of the state is less than 1%, Danbury is about 7%. So it does worry us that that number has gone up quite a bit. A lot of that is perhaps related to populations that come in from out of the country, maybe visiting folks at home. So we have to be able to address each and every one of these special populations, tell them the importance of quarantining and the importance of testing. And with that, you have to find somebody who can speak the native language in order to talk to these people. And who do you think we go to for that, Max?
Meu nome é Albert Coe. Eu sou médico infectologista, professor da Universidade de Yale, em New Haven. Estou apoiando o governador e sua equipe de saúde pública.
All right, that's good. The point is, Dr. Coe, who's the leading epidemiologist in the state of Connecticut, who was co-chairman of our Reopen Connecticut campaign, is also talking Portuguese to the affected population. He throws a tight spiral football, and he'll be also talking in Svengali to another population very soon. This guy does everything. But seriously, what this says is how we have to reach out to each and every population, talk to them in their own language, and in this case, as Dr. Coe is doing, is reminding them quarantining and testing, that's the law, those are the rules going forward. If you keep moving that forward, we've had a farm worker housing in East Windsor. Again, we watch that. These are folks, they live in very, very tight quarters. They're working on farms here as well as, I think it's Massachusetts. 30 out of the 90 people there infected. This is why we're doing so much testing, so that we can detect people early on in the cycle, get them track and traced, and narrow the scope, narrow the spread of this virus in any way we can. And to date, we've been relatively successful there, I think. The nursing home in Norwich, again, 15 infections, a big problem. We're looking hard to see how that happened. Sanctions will be implemented. But I just want you to know that that's one nursing home. All the other nursing homes around the state of Connecticut combined, 4 infections. So we're trying to get a handle and look at these flare-ups before they become fires, and that's really important. Again, we're just reminding people, follow the rules, self-quarantine, wear the face coverings, social distance, and get tested. We have testing, we're more prevalent, we're more likely to do it than any place else, and we're doing this because this allows us to contain the nature of the spread. You know, with that, I really want to introduce Beth Bai. She runs our early childhood, and this is really important. Beth and I were on with hundreds of child care workers and providers today, and there was some anxiety there. I'll tell you, they say, look, I see the teachers are anxious, and maybe they're going to be a hybrid, not a full-time basis. Some of them are 2 days. Some people are home 3 days. Some people at home 3 days. They can't be at home, so they're going to be at daycare. We have to ramp up. Everybody's going to have a different 2-day, 3-day cycle. And the potential is that that expands the exposure, expands the nature of the cohorts. We take this seriously as well. I know how seriously you take the health care of your teachers, which we do. And we were there to give them confidence that we're there to back them up as regards what they need in terms of masks, what they need in terms of disinfectant, what we can do to make sure that they are continuing to provide service safely for those most in need in our child care facilities. And Beth, I just want you to know, I was so proud talking to these workers. I mean, it was during the very height of the pandemic, Beth. We desperately needed them. We needed them there as you helped set up freelance child care right next to our hospitals, so nurses had safe child care so they could take care of those who were sick. No questions asked. These are the providers that went right in and took care of people. And I want you to know that we need you again. We need you going forward. We're doing everything we can to keep you safe. Beth, any comments?
Yeah, thank you so much, Governor. It was wonderful to have you on this morning with the early childhood providers. Let me start by saying, as a resident, seeing 0 deaths over 3 days, I know so many people around the state watch those numbers. It's really testament to the residents of Connecticut and to your approach that I think that I know we're not out of the woods, but that's wonderful. Yeah, you know, I don't know if people know, but 70% of households with children 0 to 11 need childcare in order to work. And so these are really challenging times for parents and for programs. Those childcare workers, like you said, Governor, have been on the front lines. Between 1,500 and 1,900 programs have been open since March, and they've been doing a super job following public health guidance, hand washing, cohorting, making sure that they talk with parents about not sending children when they're sick. And out of those 1,500 to 1,900 programs, the Office of Early Childhood has had just 50 cases reported in child care. So the hard work of those providers following public health guidance has helped parents be able to get to work, has provided children with really needed structure, routine, and education, and has also kept children and workers safe. But as you said, they're anxious. They still need the PPE. They need enhanced guidance. And it's a really stressed field right now financially. And so the state has invested more than $100 million in state and federal funds so far over COVID. And we're working closely with our federal delegation to try to get another 100 to 300 million so that these programs can sustain through COVID. And Governor, we really appreciate you and the Lieutenant Governor's connection with our congressional delegation and Dan Desimone to get these critical dollars. So we have had good outcomes. We're really proud of the providers. As you said, the hybrid models are challenging for them because camps and childcare have done a super job, but they've been in one cohort. So now as families use them for childcare out of the schools, it's, you know, children back and forth between different cohorts. So they're really going to have to be extra cautious about the health guidance and about looking for any signs of illness before children walk in each day. Governor, today you committed to testing for childcare workers, and they were so relieved to hear that. They have been getting tested as needed, but you've agreed to make it easier for them without the costs. And over the past month, we've been rolling out business grants and supply grants to try to help. And we know these are important, but they're not sufficient. So we're going to continue, like you said, to stand with childcare providers who've been there for our state at the most difficult time, despite their own anxieties for children and families. So happy to answer questions as needed, Governor.
No, thank you, Beth. And as Beth points out, for that second grade class, if they can stay with themselves over 5 days, that's much safer for them and their teacher rather than have them 2 days with their second grade class and then the rest of the time with a different group out there, like, for example, at a child care facility. That's really worth remembering as we slowly ease into our school day. And also, as Beth pointed out, look, we have 1,400 providers. We had thousands and thousands of kids as well as teachers, there for the child care, going back to March, I think it is, and 50 infections. So as Beth is pointing out, it was probably safer at daycare than it was in the general population, just like it was safer as a nurse than it was in the general population if you take the necessary precautions, and we're doing everything we can to take those necessary precautions. Max?
Fox 61.
Thank you. Governor, my first question, with all eyes on Danbury at the moment, do we have a plan for the surrounding towns of Danbury when it comes to the COVID-19 infections as far as reopening and as well for education for those parents who are a little bit worried about their kids going back to school being so close to Danbury?
Yeah, well, first of all, Josh and Deirdre have really had the COVID cavalry has come into Danbury. We ramped up our testing dramatically there throughout the community going forward. Mayor Mark Boughton has canceled the youth sports, at least through the summer, and probably longer than that, just to be. Connecticut State University, the residence halls were going to be filled. Now they're not. We're going to take a pause on that. So we're doing everything we can. The nursing homes, we're testing everybody again in those nursing homes. So we are bringing in the bucket brigade there to make sure that any flare up there we take care of immediately. And more broadly, to your other question is, what does that mean to the greater region? As you look at New Fairfield and the other towns in the area, we're watching that very closely. So far, their infection rates have stayed very low, and that's why their schools are continuing to be able to open on a regular basis as they see fit.
Thank you. And one more question, if you don't mind. When it comes to what we're seeing nationwide as far as Wisconsin goes, in Kenosha, where we saw a African-American male being shot in the back 7 times by police, we were wondering if you saw the video and had any comments on that.
I was shocked. My God, just so soon after George Floyd, and you thought that was a wake-up call. And my God, that will never happen again. And there it is. Right there, in the video. I did take a look at that, and I see the frustration, I see the violence, and I hope other states reacted like Connecticut did. We showed that we take this seriously. We love and respect our police, but we also hold people accountable. That's why we did the police accountability bill, and we don't necessarily stop there. I was shocked to see that, and shocked that it continues again and again and again.
Thank you, Governor.
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. Just following up to the president's announcement yesterday about the emergency use of plasma therapy. Have you talked to any of the hospitals here in Connecticut today? Do you have any expectation that that therapy, that treatment would be expanded now here in the state for potential patients?
I think I'll probably defer to Josh on that. I just think you have to be careful about all these new therapies. We've been doing some plasma therapy at some of our hospitals right now for those particular need, but it is not a miracle cure. And it's really important that the FDA maintain its credibility, because we are going to have therapies, and someday we are going to have a vaccine, and people have to have confidence that we didn't rush this, we didn't cut corners, we did it in the appropriate way so that the therapy of the vaccine can be safe. If people have doubts about that, we're not going to be able to implement them. Josh, anything else?
Yeah, I think that's well said.
And just also in terms of the schools, I know we've talked a lot about if there is a positive case, whether a teacher or a student, that the cohorts would be quarantined. But what about the rest of the school? Would all the parents of the school be notified that there is a potential case?
I would think they should be, but let me check with the powers that be on that. Most importantly, we don't have to shut down the middle school. We don't have to shut down the school if we kept the cohort tight, meaning just those kids within that third grade class. Those 24 kids would have to quarantine plus the teacher for a period of time. That's why cohorting of these pods is such an important part of our reopen strategy.
Governor, if I can just speak to what's happened in
Please.
childcare when there are cases, it's a really great question. And I think for schools, as with childcare, the parent communication is key, having parent trust. And so when there have been cases, even if they're kept to a cohort, the childcare programs have notified everyone in the program. So every parent knows what's happening, but local health guides the decisions about whether to close one class or two classes, depending on staffing and how tight the cohorts are. But keeping the cohorts tight, as the governor said, is critical. So that's just what's happened in childcare.
Channel 3 Eyewitness News.
Yes, Governor, keeping on the theme of schools, the White House is labeling teachers as essential workers, which means that teachers exposed to the virus but who also show no symptoms could return to the classroom and not have to quarantine for 14 days. How are we planning on handling that here in Connecticut?
I hadn't focused on that, but I think if you've been exposed to the virus, you should quarantine for 14 days. Now let me ask Albert Coe.
Yeah, no, that is certainly the guide. The strong guidance from our public health department is exactly as the governor said. People who have been exposed to the virus absolutely need to stay home, self-isolate for 14 days. That is how we stop the spread. And so that's an important individual responsibility for anyone who's been contacted or exposed, but it's also a community responsibility when we're working with our partners in Danbury and other communities. Help out your neighbors and your friends who may have been exposed, right? They may need food delivered to them. They may need help getting a kid somewhere. And so this is a team sport that we have to work together, whether it's in a school district or in a community like Danbury that needs a little extra help right now.
Got it. Then also on schools, last month the guidance came out encouraging schools to have UV light and extra ventilation for classrooms. We wanted to know, to what extent were local police departments consulted when crafting these plans? Because we've heard from a couple of local chiefs concerned about school safety. They're worried that too many openings or too much ventilation could pose a safety issue in and of itself.
Boy, you got me there. I think that's been probably left up to local superintendents and principals to deal with the local police in terms of that. But you're right, we've made a special effort in terms of ventilation. We found that 4 feet, 6 feet, 8 feet separated is a lot less important given the nature of the aerosolizing of the germ than ventilation. Sometimes you can do it by opening windows, sometimes you can do it with a filter on some of the air holding systems. That is a priority for us.
News 8.
Good evening, Governor. What are the protocols for self-quarantining? For example, if your daughter or son is in a cohort that tests positive, and maybe this is for Commissioner Bai, what are the protocols for the parents? They have a child that has potentially been exposed, comes home. Do they have to isolate that child at home? Do the parents have to self-isolate and maybe work from home, or can they go to work?
What do you think about that?
The CDC has published extensive guidelines on all those scenarios you just described, and I'd encourage anyone who has specific questions on those types of different scenarios to go to our main website, ct.gov/coronavirus, and there you can find extensive links and resources for parents or anyone else who has questions about how to effectively self-isolate.
And so for children also, so you bring your student home from school, they've potentially been exposed, and you isolate them at home, or?
Yeah, again, go to the CDC website. There's tons of guidelines. Okay. It's a lot of the things that you would expect. When you read it, it reads a lot like common sense with a sick child, the things you need to do to keep them safe and keep the rest of the family safe at the same time.
News 12 Connecticut. The Associated Press.
Thanks, Max. Governor, today representatives from the state's teachers unions and some other labor organizations, they said that there are a lot of districts that are pushing ahead with reopening in-person learning, even though they don't have proper ventilation, enough space to keep everyone 6 feet apart. And they say it doesn't make sense to reopen if these measures can't be taken. They also unveiled, I guess, 13 what they call non-negotiable core principles for reopening schools. I wondered what your reaction is to that plan, and also, is the state going to be checking back with these districts to make sure they are following proper protocols?
Well, we'll definitely be checking back, Sue, to make sure they're following the protocols, and I think parents will be reminding us of this, and I'm sure teachers will be reminding of this, because our job is to give the teachers and the parents and you know, their kids the confidence that we're only going back as long as we can do it safely. You know, Beth is here talking on behalf of a lot of the child care workers. I mean, they were anxious, no question about it. They were anxious at a time when we had a 20 and 30% infection rate, and they were going in, and we did everything we could to keep them safe. And as Beth pointed out, overwhelmingly they were kept safe, and safer probably than the general population. So I do urge all those involved in the schools, look, I'm not rushing people back. We've always led with public health. We're probably going to slow things down in Danbury, given the nature of the situation in Danbury. But I'm doing everything I can to make sure these kids get an opportunity to have a real education, and that involves socialization and in-person learning as long as you can do it safely.
Are you concerned, though, about these surveys that I know CEA had conducted that find that there's a lot of schools out there that they're not able to follow through with some of these safety measures?
Oh, look, when it comes to the safety measures, we've been very clear. We've got your back. We're providing all the masks that you need. We're working on the ventilation systems. We're doing the disinfecting. We're making those changes we need to open safely. We've looked at what's going on in Europe right now, Sue, and there, especially K through 8, they've opened safely across Europe, and very, very few problems there. There have been problems in other categories. There have been problems at universities. There have been problems with parties, and even some issues at high schools. But K through 8, we really think we can get that open safely, and the moment we think we can't, we turn the page.
In the Connecticut Interscholastic Athletic Conference, they're supposed to, I think, finalize a timeline for fall sports this week. Have you signed off on any plan, and what restrictions would you like to see?
Well, I can tell you that Deirdre Gifford, Public Health, has given clear guidance to the athletic teams in terms of the level of safety on different sports and how to get that implemented. Paul, do you want to speak to that?
Yeah. Department of Public Health has been in constant conversation with the CIAC based upon their questions in which DPH provided recommendations, in which CIAC, it's up to them to make a final decision on high school sports and whether it be played. One of the things that DPH has said specifically was about volleyball and football. Even as I'm looking right now, the National Federation of State High School Sports, in which the CIAC is a member of, puts football as a higher risk sport. And for the reason that it's a sport that involves close sustained contact, the lack of protective barriers, high probability for respiratory exchange, DPH had to make those recommendations based upon not only what the National Federation of State High School Sports had put forth, but also based upon what the guidelines that CIAC was looking to put forth as well. So at the end of the day, DPH provided a letter yesterday which reiterated the previous guidance that they provided before, and CIAC will be in the position to make a final decision on sports going forward. But at the same time, DPH has provided alternatives and options for them to think about understanding the overall health risk for all the various sports that will be taking place in the fall.
Thank you, Paul, and thank you, Governor.
The Hartford Courant.
Hey everyone, this is Emily Burnley from The Current. I had a couple questions about the COVID-19 alert that was issued for Danbury. The first is, are there any specific metrics that are used when you're deciding whether or not to issue an alert, or are there metrics that you might use in the future when you're evaluating whether to issue alerts for other towns?
Over to you.
Yeah, no, it was at the end of the day, it's a judgment call, Emily, and it was based on discussions both with our public health department here at the state as well as with the mayor and the local health department in Danbury. And it's evaluating a wide variety of factors. Certainly it's the metrics and the case counts and the trend lines, but it's other factors as well. And so working together with our partners in Danbury at the municipal level, that was the judgment of the Department of Public Health on Friday, that we were seeing enough to know that we wanted to get the word out more aggressively about what we were seeing and the actions that we wanted to see the community take to make sure that we nipped it in the bud.
And when an alert is issued, can that municipality then issue any stricter measures like a lockdown or anything like that? Or do they still have to go through the state and get permission to do something like that?
Yeah, well, I think the measures that we've seen taken in Danbury over the last weekend is a good example of what we'd expect in kind of the first instance. So closing down some activities that have been viewed as areas that have been contributing to community spread, such as perhaps some of the sports events or the parks or a boat launch as an example in this case. Looking at curtailing some religious gatherings in the short term, and mostly flooding the community with additional testing, which is what we've done extensively over the last week to really get our arms around the cases and make sure that the people who are positive or who have been exposed to someone who are positive are self-isolating so that we can control the spread. But it will really be, I think, specific to the community in terms of what they think they need and what supports we can provide to help them contain it.
Okay. And then finally, with the message that Dr. Ko sent out in Portuguese, it sounds like you're saying that Danbury's outbreak is directly linked to the Portuguese community, but Mayor Boughton told us that that's a false rumor. So are you saying that this is linked to the Portuguese community?
So first of all, there is a significant it's the Brazilian population actually in Danbury who speaks Portuguese, of course. And the mayor's right, it's not exclusively about that community, but there is a sizable Brazilian community there, so we wanted to make sure that we're reaching out through every channel we possibly can, trying to reach everyone in the community to make sure the word is getting out adequately. And so we're appreciative of Dr. Ko, who, having lived 15 years in Brazil and being fluent in Portuguese, contributed his skills with the Tribuna newspaper there and other channels to help make sure people were aware of the risk. And this just shows overall that the kind of stance that we've been taking as a state to make sure we're communicating to every and all populations within our state. So this is a perfect example. It doesn't mean that we're targeting one particular community because of the spread happening with that community. We're targeting a whole town and making sure every person understands the risks that are that we're dealing with right now.
Thank you.
The Connecticut Mirror. Hearst, Connecticut Media.
Thanks, Max. Continuing the Danbury discussion, Governor and Josh, so was this manifesting itself as people not social distancing, people not wearing masks, whether English is a second language or not? How are these reports getting there?
Yeah, the primary contributing factors that have been identified so far have to do with travel, so both domestic and international travel, potentially bringing cases in, introducing them at parties or family gatherings where people are not wearing masks and not socially distancing. So that's why we want to get the word out aggressively about that needs to stop. The people need to adhere to the travel advisory and make sure that if they have been in an area that's been exposed heavily, that they need to self-quarantine when they get back to Connecticut to make sure that this doesn't happen.
Thanks, Josh. And Governor, going back to Eversource, how do you understand the degree of difficulty it might be to break off the Connecticut portion of this multi-state power company and make it more accountable and possibly publicly owned?
Look, I'm going to leave that up to Puro. I got to say, that doesn't sound like an answer to me. What makes sense to me is making sure our incentives are aligned. Right now, if I'm the CEO of Eversource, I would probably try and raise revenues and cut expenses as much as I can. And if there's a bad storm, I'll get it fixed as fast as I can. But I'm not going to spend a lot of extra money pre-positioning people unless they absolutely have to. I think it's time for us to change those incentives so that Eversource and the customers are all 100% aligned in terms of the risks and reward of pre-positioning, getting the electronics in place, doing everything we can to harden the grid. We're going to have to do that because these storms are just coming more and more frequently. Then you look at the rising sea coming in from Long Island Sound and the such. Our grid is at some risk, and we got to prepare for that.
Thanks, Governor.
CT News Junkie.
Thanks, Max. Governor, I wanted to know what your feeling is about kids who are in this hybrid model, and the hybrid model is different in every town in Connecticut for the most part. What you think about these learning pods that are cropping up, and if it will exacerbate the achievement gap that already exists in Connecticut?
I do, Christine. That's just what I worry about. Look, if I didn't feel that my kid could go to school, we'd probably create some sort of a learning pod and get some other like-minded parents, and we'd have a Zoom, and we'd have education, and a lot of kids would be able to power through this. A lot of kids don't have that same opportunity. And something like 30% of the kids never even turned on their computer last time around, even though we provided them computers, and even though in many cases we had the Wi-Fi powered up. I don't want to do anything I can to exacerbate that achievement gap. And it was just a few months ago that we were out there saying Black Lives Matter. And now I worry that we're going to leave behind a generation of kids who don't always have all the best opportunities to take advantage of the distance learning. So you're right. I feel pretty passionate. As long as we can do it safely, there's nothing like face-to-face education.
Is there a possibility that the state or some sort of nonprofit organization would step in and, begin helping out with payments for childcare? Because this was never, we're paying our tax dollars in addition to we might have to pay more money in order to continue to educate our children.
Yeah, that's sounding very complicated to me, Christine, but I have seen some really school districts that I think have been very clever, that have said, hey, look, we're going to have a hybrid model, but for those kids whose parents are working or they can't go home alone, we're going to set up a separate computer lab for them on campus, probably in what used to be the cafeteria, so that we can monitor them a little bit. They can keep their education going without being in the classroom. So there are ways that you can do this. But to me, though, September and October are great months to be doing K-8 education, in part because you could do it outside. And it's so much safer outside. That's what we're learning on restaurants. That's what we're learning throughout the rest of our economy. That's what we found in the 1918 pandemic. So I would urge schools to think creatively about how we can continue to educate kids safely, and outside could be part of that solution.
Thank you.
The Waterbury Republican American.
Hi, thanks. Just kind of a housekeeping question to start off with. We were told there's 1,400 child care facilities. Then we were told there's 1,500 to 1,900. Exactly how many are there?
Yeah, I'm happy to answer that question, Paul. How are you? There have been between 1,400 and 1,900 programs open. There were fewer open in March and April and May, and more coming online. Now we're about 1,900 programs.
Okay. Will that be sufficient for the child care needs?
No, particularly with the public schools. So at this point, we are at about 50% of our pre-COVID capacity. We've just increased the allowable class size to 16 per class, so that will bring us up to about 60% of our pre-COVID capacity. And to the extent that schools are not fully open, that more than doubles the number of children who need childcare. So as the governor said, we're really looking to communities to listen to parents and find ways to support the families at this time, and the State Department of Education and the Office of Early Childhood issued a joint guidebook to communities that are looking to support their families with some of the child care challenges given the approach to reopening school that some are taking and how that impacts childcare.
And of the 50 cases, were those children or were those children and staff?
This is through the end of July, there were 37 staff and 10 children total.
Okay. And this is, I guess, an unemployment question for, I guess, the governor, Josh or Paul. The Department of Labor was looking into approximately 500 unemployment applications for current state employees who were ineligible for unemployment. What's the status of that review?
Did you follow that?
Yeah, well, Paul, we can get back to you offline on that question.
Okay, then let me ask the governor. How concerned are you about the child care situation?
Well, I'm concerned about everything, but look, these child care providers, we kept our daycare open during the height of the pandemic. Some other states didn't do that. These child care workers are right there on the front line, taking care of the children of nurses and doctors and food service workers, making sure that our essential functions could continue during the height of the pandemic. And these are amazing people who are going to step up again and do what it takes so we can get our schools reopened safely.
Yes, but I mean, parents are going to need child care if they're going to go back to work. And I'm just wondering, you know, are you concerned that parents are going to find themselves in a bind?
I think a lot of parents are going to find themselves in a bind. It depends on how many schools open, at least K through 5 full time. We're going to have a better handle on that pretty soon. I think you're going to find a majority of them will do that. At least a majority over the next few weeks will be doing that, and that's a good thing. In the meantime, Beth and her team are trying to put together daycare options just to support those families.
Beth, did you want to add something?
I would agree with the governor. It's not going to be easy, but we are looking at options, for example, like letting camps extend and open during the school year so that adds capacity if they choose to do that, and other things like allowing family child care homes to accept school-age children as well. Those are things we're working on with the Office of the Governor. And we'll continue to work to support families in collaboration with the State Department of Ed and the cities and towns. I think we're really going to have some local solutions as well.
Okay, thank you very much.
All right, I guess that's a wrap, everybody. Hey, Beth, thank you, and I appreciate the opportunity to talk to the child care workers. You know how, look, what they did back in March, April, when they didn't necessarily have to do it, how vital they were, what they're doing now to help complement our schools, give people confidence getting back. That's the spirit that really helps the state keep going forward. And I want them to know every day that I got their back. We're doing everything we can to keep them safe. It's worked so far. We're going to keep going. Thanks, everybody.